This is the suprasternal scan of the patient, where you can see this is the left subclavian artery and this is the arch of aorta, and this is the descending aorta, and the descending aorta, you see that the aorta is markedly narrowed over here, suggestive of coarctation of aorta. And this is a case of coarctation of aorta giving rise to the radiofemoral delay and giving rise to the difference in the pulses on both the sides, right hand as well as the left hand, and similarly causing the difference in the blood pressure. And when we put color, we find there is aliasing the arch of aorta, and when we try to measure the pressure gradient across the arch of aorta, we find that the pressure gradient is around 33 millimeters of mercury, with a maximum velocity across the arch of aorta being 2.87 meters per second, suggesting that this is significant aortic coarctation. And the aortic coarctation is generally seen distal to the origin of the left subclavian artery, and you are seeing that this is the coarctation of aorta. And whenever there is coarctation of aorta, one should try to look for the patent ductus arteriosus. There is no patent ductus arteriosus over here, and this is a case of pure coarctation of aorta. And once we see that there is coarctation of aorta, we should try to look for the other findings which we can be seen in the coarctation cases. This is the scan of the ascending aorta, and you see that the ascending aorta is well dilated and well normal in size, and there is no aliasing in the ascending aorta, suggestive of normal flow across the ascending aorta, arch of aorta, but there is coarctation in the descending aorta, giving rise to the aliasing and the pressure gradient across the narrowing. This is the pulse wave Doppler scan of the ascending aorta. This is the superior vena cava. This is the ascending aorta, and you see that the velocity over the ascending aorta is 1 meters per second, which is nearly normal, and there is no pressure gradient across in the ascending aorta, suggesting that the ascending aorta is normal, but there is pressure gradient across the descending aorta, and the velocity being 2.87 meters per second, suggestive of increased pressure gradient and coarctation. Gone through the ascending aorta and established that there is coarctation in the descending aorta distal to the origin of the left subclavian artery, we decided to look for the scan of the abdominal aorta. This is the abdominal aorta, and you can see that the abdominal aorta is apparently normal. There is no loss of diastolic. There is mild loss of diastolic flow, but the systolic flow is normally peaking and appears to be a normal descending abdominal aorta scan. This is again the abdominal aorta scan, and this is the normal sized abdominal aorta, which is normally contracting. So there is coarctation at the level of descending aorta only, and beyond that the aorta appears to be normal in size. When we measured the the abdominal aorta, we find that it is 1.1 centimeters, which is normal for this age. And this is the coarctation side, where the diameter of the descending aorta is not more than 0.81 centimeters, while the descending aorta, and when the arch of aorta is 1.72 centimeters, which is normal in size, and the ascending aorta is 2.56 centimeters in size. And this is again 2D scan, where the arch of aorta is also 2.26 centimeters in size, nearly 1 inch and this is the measurement of the left subclavian artery, which is 1.06 centimeters in size. And this is the scan of the abdominal aorta, which is showing some loss of diastolic flow, but the peaking of the systolic flow is normal, and there is no retarded flow in the systole. This is the trace of the right femoral artery, and the femoral artery was low in volume, but the femoral artery flow was normal triphasic flow and apparently normal flow. And this is the left femoral artery, which again showed a normal triphasic flow in the left femoral artery. And having established that the femoral artery is normal, we try to look for the carotids, and we find that the carotids, this is the left common carotid artery, which is normal in diameter and showing normal flow, and this is the right common carotid artery, which again shows a normal flow and normal in caliber. and this is the flow across the pulse wave Doppler across the right common carotid artery, which is a normal flow. So we have been able to demonstrate coarctation at the level of descending aorta distal to the origin of the left subclavian artery. Whenever one sees the narrowing in the any artery, or this especially the major artery, one has to look for the aorta aortitis or the congenital coarctation. In the aorta aortitis, the narrowing can be seen at various levels in the aorta and various arteries, but here we were able to establish the narrowing only in the descending aorta. So this is the case of congenital coarctation of aorta, and unlikely to be a case of aorta aortitis, though the final diagnosis will be established or ruled out by the distal subsection angiography of the aorta and the related vessels. Thank you very much. You please like our videos, subscribe to our channel, and share it with maximum number of friends so that large number of people can be benefited. Thank you very much.